Welcome you into CommonWell TV 2021, right here from our Orlando studios, as we're introducing you to some of our CommonWell Health Alliance members. And joining us now, the COO of Zeus Health, that is Evan Grossman. And Evan, the reaction from Zeus Health when it comes to the ONC info blocking regulation.
So I think we're thrilled. Like everyone else, I guess we could whine that it took a little too long, but and I think the proof will be in the actual liquidity of data flowing forward. So I think the regulation does a good thing in terms of saying, like, there's only a few instances where it's acceptable to block for security, lack of patient consent. And Zeus exists to share information and to help the new group of digital health revolutionaries get access to data that often old medicine has locked up. And so we're very for it. I think it will take time to understand exactly, between the payers, between health systems, and between other parties in the health information ecosystem, if they're all for the liberating of the data the way CommonWell has been such a strong advocate for over the years. Because I think, all of us feel healthcare is better when the doctor has all the information she needs, at the point of care, or in other situations, before she talks to a patient. But unfortunately, as we all know, that information has often been locked away in silos. And so to the extent the ONC regulation gets it unlocked away and empowers providers to actually have the information they need to provide the best care for their patients, that's an awesome thing.
Evan, obviously the past 18 months has been historic on many levels. So when it comes to, what's forthcoming, what's on the horizon for health IT?
Well, I think the last 18 months, let's focus on the silver linings, not all the tragedy, right? I'm kind of a glass 3/4 full person, and it moved most physicians 20 years forward in terms of accepting virtual visits in digital health. It moved both physicians and patients, to be fair, right? And so it's very corny to say necessity is the mother of invention, but pandemic clearly created, was the mother of a lot of healthcare innovation. And the acceptance of virtual visits, the need for coordination of care, for data sharing, for folks to use info on the CommonWell network because it wasn't going to be in the filing cabinet because they couldn't go into the office, is all wonderful. So I think the next 18 months are going to be building on that. We're going to see a lot more virtual care, a lot more virtual first care, even if all the care, obviously we're far away from being able to operate on someone virtually right now. Maybe Da Vinci has a plan at some point in the future, but but there is a lot of care, I think in terms of behavioral health care, right? We've moved ahead, 20, 30 years in terms of people's ability to access therapy and their comfort, both the therapist's comfort and the patient's comfort with doing things online. So I think what's really exciting is we're at the precipice of people being able to select the best care available to them, regardless of where it's available in the US at this point. And right, instead of in the past, like, okay, I can get the absolute best care in Northwest Nebraska, but I can't access some specialist I might want to access. And now it's like, no, that all makes sense. The people around the country are comfortable providing that care. The patients are comfortable going for that care. So I think we're going to see a lot more innovation in healthcare as these models progress.
Evan, I know you're no stranger to CommonWell. Zeus Health, one of the newest members to the CommonWell Health Alliance. Why is this partnership so advantageous for Zeus Health in your estimation?
Zeus Health really exists to empower a whole new class and cohort of digital health entrepreneurs that are providing new solutions, new technology to transform digital health. People like CityBlock, Oak Street, Firefly Health. And one of the things that those folks have in common is most of their patients are new patients. And they need a lot of information on those new patients, and they need to coordinate the care of those new patients with a much broader ecosystem of specialists and health systems. And so the ability of CommonWell to gather information from other health systems and for providers on Zeus to then share the information via CommonWell to other health systems is really critical, because no patient wants their data to be an island. Even if they're with their favorite new digital first provider, like if that person can't share with the local hospital or with someone else, it's no good. So, we are just as Zeus exists to provide a set of tools to simplify getting into digital healthcare for our builders, CommonWell is a great tool to simplify interoperability. And so, the last thing we wanted to try to do was rebuild a very good network ourselves. So we're thrilled to join, the most successful network for sharing patient information and provide that as, core foundational service to all of Zeus's builders.
He's Evan Grossman, the COO of Zeus Health. And for more information on them, we invite you to log on to CommonWellAlliance.org. So good to see you again. Once again, Evan, thanks so much.
Thank you, Scott.
Thanks for watching this episode of CommonWell TV. To get the latest news and updates, follow CommonWell on Twitter. We also encourage you to subscribe to our CommonWell YouTube channel and hit the bell icon to receive notifications when a new episode is posted.